Yeah, it says recording. So let's talk about what the plan is for today. Well, first of all, we're going to talk for a while this morning. And that can be pretty annoying to some people because they sit there and they say, okay, now Dr. Rutledge, I did the packet. I didn't like it. And I don't really like you for making me do that. I sat in clinic yesterday for 3 hours, which I had very mixed feelings about. And now I'm ready for the surgery. Let's cut out all this discussion. I've written out my permission form twice. Let's get underway. And that makes perfect sense, except we're not going to do that, and I would like to explain why. Again, we are creating a very unique bond, and that is that doctor-patient relationship wherein each of you is entrusting your, one of the most precious possessions you have, which is your health, to me. And in a perfect world, I would have met you a dozen or more times, maybe even grown up next door to you. You would know my character, my personality, my commitment to good patient care, and we would have that as a foundation of our doctor-patient relationship. Since we don't have that, since as a bow to your convenience, we haven't made you make more than one trip from Nebraska or one trip from Connecticut, we're going to use all the time we can with you now. We're disappointed that we can't get to know you better. We're disappointed that you live so far away. And so while we've got you here, we're going to hold on to you tight. We're going to use this time this morning. So part of this morning has nothing to do with actually answering questions. Part of this morning is just getting to know one another. It's talking with one another. It's me reaffirming my commitment to give you the very best possible medical and surgical care that I can. That commitment is something that motivates me. It's what starts my day and ends my day every day. And I want to emphasize that to you. And we're going to take time to spend time with one another this morning. And so I know that many of you have this kind of feeling of let's get this underway. And I apologize. We're going to take some time this morning and talk. So I hope that's acceptable. What happens after we finally finish talking for an hour or so is that our first patient will get ready and we'll go over to the operating room. We'll go down the hallway here with your husband. At the elevators, he'll go to a waiting room in front there, and you'll go back into the operating room. There you'll meet the nurses who are working with you. A lot of the nurses back there have actually had the surgery, and so they can chat with you. You'll meet our nurse and the anesthesiologist for today, Dr. Barendez, who's done thousands of these cases with me, and a really nice guy, and we can talk about the anesthesia, for example, if you want to do that. You'll have a few minutes where they'll ask a few questions, the same thing again. For safety, for example, they'll ask you what kind of surgery you're having, because of the potential that, somebody might get the wrong hip replaced or something like that. So make sure you say you're getting an MGB, because otherwise, you might be surprised to wake up with a tummy tuck. But you'll talk with our nurses and anesthesia, and they'll prepare you. And then you'll go into the operating room. They'll move you over to the operating room table. And as you're getting ready, you'll drift off to sleep. And then in what seems like a blink of the eye, you'll wake up. When you wake up, we'll ask you to move back over to the bed and then to the recovery room. And sometimes you won't remember any of that. It's very rare to have, it's very uncommon to have a lot of abdominal pain. You can have some, but the nurses will be right there in recovery room with pain medicine if you need it. Our new anesthetic technique has decreased the need for pain medicine from 1 or 2 doses for every patient to now 1 or 2 doses for every 10 or 20 patients. So the new anesthetic technique uses a new type of anesthesia research called opioid-sparing techniques. Opioid-sparing or narcotic decreasing techniques are safer for you because narcotics, although they're good pain relievers, depress respirations. And by avoiding narcotics but still controlling the pain, you'll be able to breathe better. Good morning. You'll be able to feel better and have less risk of going through the surgery and the anesthesia. In recovery room, as soon as I finish the operation, I'll come out and find family and say hi and tell you how the surgery's gone. I'll report on what the liver looked like and how much we bypassed and the vital signs during anesthesia and how the operation's gone, how much bleeding we've had or things like that. And bleeding's usually about a teaspoon. And then in recovery, you'll wait there for about an hour to 2 hours until you go up to the 4th floor, where you'll begin to start to wake up. A couple things to talk about your recovery on the floor. Sometimes, because of the medicines we use, you may be sleepy. And some of our patients, because they're kind of commander-in-chief kind of go-getters, don't like being sleepy. So they'll argue with me, going, I'm sorry, I'm trying to wake up, but I can't wake up. And I'm going, well, then relax. You know, you don't need to be awake. So, but we get people who are just there, you know, I must be awake. You know, I'm going, well, but the medicine is designed to kind of take away the edge of the pain, make you a little bit sleepy. So if you notice you're sleepy today, that's okay. If you feel like you have to do something, put it off till tomorrow, because today you're going to be sleepy. And so we do get some people who get this kind of funny feeling, I can't wake up. I'm going, well, don't, just relax. That's the opioid-sparing technique of the ketamine. It makes you a little bit sleepy and groggy, and so the best thing to do is just relax. Go ahead and sleep. Another thing is that you may have some pain or discomfort. And if you do, we have a set of 3 levels of pain medicine for you to use. The first one is attached to your IV pole with a pump and a button for you to push is going to be your own patient-controlled analgesia. It's going to be a big plug full of narcotics that you can pump into yourself for pain. But if you think about it, that sounds like it could be dangerous. And we are working with what we call the public. Any of you in your business work with the public? All right, they're a wacky group out there, right? So, intentionally, that narcotic pump is armed with a very low dose of narcotics. So don't hesitate to use it. We have found people misuse it all the time, and so that's why it has such a light dose. And I'd like to give you 2 stories about how the pain medicine pump has been misused so you can understand why we don't put a stronger dose in it. One morning I came in and the husband was pushing the button on his wife's pain medicine pump, and he looked up at me and said, she was kind of annoying me. I'm going, no, that's not what that's used for, sir. The other thing, I came in one morning and there was a patient laying in bed. She had the pump, the button in her hand, and I said, hey, how you doing? She said, terrible. Real groggy, asleep. I said, what's wrong? She said, I really have to go to the bathroom, but I've been calling the nurses all day. So she got confused about which button was which, and she really needed to pee, but the nurses didn't know about it, and she kept falling asleep and her bladder was getting worse. So the pain medicine in the pain medicine pump does work, but we've intentionally set it to lock out at a very low dose because I just can't trust you guys with narcotics out there. So that's the first line of defense. Don't hesitate to use that. It's there. It's in your bed. You don't have to wait for a nurse to unlock the cabinet or anything like that. So don't hesitate to use that. The second line of defense is the most powerful, and that's an intravenous injection of narcotics that the nurse has already ordered for you. You just have to say, I'm in pain and I want that pain medicine Dr. Rutledge has ordered. It's called Dilaudid. It works very well, and it's available to you at any time. It has a